Hello, calling the Fayette County School Corporation Board of School Trustees special meeting to order. We're here at the Administration Building. It's Thursday, July 2nd, 6 p.m. And let's all stand for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I would like to seek a motion to approve the agenda as submitted and amended.
Madam President, I will make that motion.
I'll second.
Thank you, Chris. Thank you, Ann. Any discussion? All those in favor signify by raising your hand. Opposed, same sign. Motion carries. Okay, we will now move on to the consent agenda. Retirements, resignations, leaves of absences, etc. And I would like to seek a motion to approve the consent agenda. A motion to approve. We're not going through the consent agenda, right? The consent agenda we don't go through. We just vote on the consent agenda.
I thought you said something about personnel.
That's
Well,
next. That's an action item.
Okay.
Oh, well, there is an action item that has the same title.
Okay.
This is the one that's,
I'll make that motion then.
thank you, Mark. Do I hear a
I will
second?
second. Oh,
Thank you, Dennis. I'll take you. All right. Any discussion? All those in favor signify by raising your hand. Opposed, same sign. Motion carries. Now we will move on to the action items. Mr. Collins and the personnel report.
Thank you. Mr. Hensley is on vacation this week, so I'm going to take care of this. We have two teachers, certified staff that we would like to recommend for employment. The first is Quentin Heisey, English teacher at CHS, and the other is Greg Sells, English teacher at CHS. So those are two new teachers for your consideration.
Okay. Do I hear a motion to approve the personnel report as presented?
I so move.
Thank you, Ann. Do I hear a second?
Second.
Thank you, Andy. Any discussion? All those in favor signify by raising your hand. Opposed, same sign. Motion carries. Now we will move on to the COVID-19 school reopening plan. Mr. Collins.
Thank you. And I'm going to direct your attention to the board. I want to show you some information. If you'll recall, we shared some information about a survey. I shared it with you that we had provided that to our staff and families just to get their feedback for what their thoughts were with reopening school. So I wanted to share a summary of that information for you. So this survey was provided to our parents and staff. It was done online through Google, and we had a total of 1,604 people complete it, which was also, and that was tremendous.
yeah, well,
And so the following slides provide a summary of this information and start just a breakdown of the participants in the survey. 1,311 were parents, as noted on the survey. We had 164 who were parents and also staff members in the district, and then 129 were just staff members. So we had close to 300 staff members complete this, and then over 1,300 parents. So really good representation of our school family, I believe. I wanted to share this, and this all comes directly off our Google report that printed this, but look at the breakdown of the number of people representing the different grades. Yeah, we had 198 incoming 12th graders. Parents complete that, and then our low was kindergarten in the K-12 with 159, but still, we were over 150 students represented in all K-12 grades. Our pre-K was a little lower, and then we had 111 who had none. That was most typically our staff that members were parents. So these were the questions we posed, and as you look through, yellow means not concerned. So we provided different questions. How much concern do you have in the following areas? On school buses, the majority certainly said not concerned, but you can see there's a pretty good balance across each of those with people who are strongly concerned or concerned. So it was really pretty split on the level of concern in those areas with meals, classrooms, and hallways, and restrooms on the playgrounds. And then the far right one is the one I want to point your attention, because the yellow there is the number of people who are strongly concerned in purple with wearing masks at school, and then the middle one, the orange one, is for somewhat concerned. So the chart flipped as more people expressed concern about students and staff having to wear masks all day at school. So I wanted to share that. Any thoughts, comments from that? Thought it was interesting.
That's what I wanted to ask, because
Right.
I was fairly certain that it was, I've heard so many people say they don't want their kids wearing
Right.
masks at school.
So this is, that last one about the masks is,
It's about wearing them, not wearing them.
So when people noted purple with strongly concerned, they expressed concern in their students wearing masks.
okay.
Oh, I see.
I
Being
see.
required
I'm
to.
glad
So
you
it
know that.
flips with the concern piece with that one.
Okay,
So, yeah, I wanted to clarify that.
okay.
Does that make
thank
sense?
you.
Yes.
Yeah.
Okay. And that was proven true in the survey because we provided open-ended comments and most everyone provided a paragraph or a few statements.
Yeah.
And so we had a lot of good feedback to disseminate. So then the next choice was we were looking at supporting versus not supporting or having strong opposition to returning to school. And that was the first section, as you can see in the purple. Those were the survey people who strongly supported returning to school. Now, in hindsight, Kim and I were talking about this survey question, and if I could have fixed it a little, in hindsight, it would have been with enhanced cleaning and safety. Because in talking to some parents, they did not mark support because they thought it would just be going back to normal. So that was an error on our part in trying to clarify. So I think those numbers would have been a little higher had we been clear on that question. Does that make sense? So the next option was going to school every other weekday, finding a way to have kids attend half day. And that was not received that favorably.
No, surprise, surprise.
And then the last was remote learning at home, 100% of the time. And the green is strongly opposed, and then the orange is somewhat opposed. We did have, though, a pretty even number who were strongly supportive or had somewhat support. So there's a significant group of people there who did have support for that too. So I just want that on record that, we had a mix there as well. Definitely more lean towards not, and I've heard that from parents all over the community, that you better get your kids back to school. So,
That's say the threats received,
yeah, that's it. So any questions on this slide? Okay. So instead of me providing 1,604 comments, I wanted to go through and do some trending with this. And so I put all this information into an Excel sheet and then tried to really find the commonalities that came up most. And from that, there were 7 areas where we felt the most significant feedback was. The first, these are not in any particular order, by the way. Improving our e-learning, remote learning plan and have that option available if we need to close school again or to support children unable to attend. That came through in a lot of comments. So we're working to respond to that. Concern about requiring face masks to be worn, primarily mandating them to be worn. That was a really big hot button topic.
It is all over the country.
Okay.
Social distancing, how we monitor and enforce this at school and on buses. That was a concern. How do we do that? Because it's hard with kids, especially, we're social creatures by nature. So cleaning of our facilities and preventing the sharing of equipment and supplies. That came up a lot is, they don't want kids sharing devices, sharing pencils. And one of our practices, especially in elementary, is you have common tubs or crates or items on the center of the tables. And you have 10 or 12 pencils in there, and you have markers and Sharpies. That's not going to happen anymore with the plan we're proposing. Kids will have their own individual supplies that are clearly marked and kept in their containers. And with us moving to a one-to-one district with technology, each of our K-12 kids will have a device that no one else will use.
So each of our kids will have their own little pencil box.
They're going to have,
In essence.
or baggie or whatever they
Baggie
have.
or whatever
Yeah.
to put their own stuff in.
Yep.
That works.
Kids at all grades need to have laptops, devices. We are taking care of that. So that came up a lot. That was a struggle for a lot of families that didn't have the technology, much less the connectivity. So with those devices, we're able to download and provide stuff through our Google Classroom, which will be a big help. Adjust our attendance policies and eliminate the incentives. That came up a lot. Don't punish kids because of the virus. So we are doing that in our plan as well, where we're going to adjust those policies and be flexible when it comes to COVID-related absences, whether it's through quarantine. That's what we're gonna propose to the board tonight. And then the other is, parents need to help check their kids for symptoms, and do not, that came up a lot, hundreds of times, don't send kids to school if they're sick. So these were the 7 prevailing comments. So any questions, thoughts, or comments?
The
From
police,
anyone?
the policing situation, it was on the other, on the previous slide, on how, concerned about, social distancing, how do we monitor and enforce this? This morning, on the Today Show, the lady who's the head of the American College of Pediatrics was talking about social distancing and the like of younger children, and how important it was to get kids back in the classroom, and we shouldn't, basically, her message was parents shouldn't be paranoid about it because the younger children don't seem to contact it as much as some of the others do. So, and children are going to be children, and they're gonna touch each other as long as the surfaces are kept sanitized and there's hand washing. And she said, one of the biggest things she said was, you cannot, as a parent, you cannot send your child to school when they are sick. When they are symptomatic, any kind of symptom, you err on the side of caution on that, because you can't get it if you're not exposed to it. So, but, how do we monitor that? So, we talked about this last meeting, how are we gonna monitor the social distancing in the hallways? We can do things in the cafeteria, certainly in the self-contained classrooms, but, if we have, 1,000 kids at the high school and 600 kids at the middle school, how are we gonna be the social distancing police? Because that's going to be very, very, very burdensome. Or do we just create an environment around them that makes it very difficult to transmit it? So, as far as the sanitation and the like is concerned.
I think we're just gonna have to preach, educate, repeat, 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 repeat.
And ask the parents to do the same.
Yes.
Ask them to help you
It's gonna get a habit.
reiterate the same things that you're preaching at the school, have the parents just say that at home. When you go to school, use the pencils in your school box. Don't borrow Johnny's pen because you like it better. Use what's in your box. Just little things like that, and have the parents just help do the same thing. Hopefully, if they hear it enough, it'll just,
I think that's the key.
Yeah.
If they hear it again and again and again,
And
I
they'll
think
get it.
eventually they'll make it routine, I hope.
Yeah.
I'd like to speak to what Ann just said. And this is Katie Rowland, my
I'm Katie.
nurse at the health department. I'm
Part-time.
Dr. White, the health officer. And Scott and Kim, thank you so much for coming and talking. I mean, this has been a struggle for everybody. I mean, what I say tonight, and my daughter, she knew my angst that I had coming here, and she sent me a text that I thought was just appropriate. She goes, I've learned that people will forget what you said, people will forget what you did, but they'll never forget how you made them feel. Maya Angelou.
That's
And so-
Chrissy.
Chrissy.
Yes!
My little attorney. Yeah, she's got the pros, and I told her, I don't know what am I gonna tell these people tonight. Everybody's gonna wanna look at me like Dr. Fauci. What are the answers, Nobody knows, for sure. And I just wanna let you know that at the health department, and Katie can attest, every morning we get together with 7 or 8 health departments around the county, surrounding counties, all referring to Reed. Dr. Huth, who's the liaison, gives us an update of all the numbers, and like right now at this very moment, guess how many are on a ventilator for COVID?
0.
0. There's 2 ventilators going right now. We have 40 waiting there collecting dust, We are not over capacitated at Reed. We can take care of anything. And that's the whole point. We were to flatten the curve, but I think we need to flatten the fear. And I think that going forward, you gotta realize, there's a new website just came out yesterday. I was listening on NPR, and the Harvard Institute for Public Health put out a tool to look at every single county in the entire country
with a rate of cases per 100,000. And you can just go on to Fayette County. We're in the sweet spot. We're like nearly green. We're up there with Anchorage and Maine, and you know we have like less than we have 6 cases per 100,000 daily, whereas Arizona, Texas, Florida, they're up in the 50 range. So they're red. They rate you red, orange, yellow, and green. So at this point, and it may change next week, we are in good shape. We've got plenty of capacity. We don't have a lot of community spread. We can track and trace every case that comes along. I've gotten my I got my 5th test today at the Optum site. It took me all of 10 minutes, door to door. I encourage anyone that wants a test, go get one. And we'll track and trace everybody, okay? With that said, what you said earlier, kids are not super spreaders. And anybody wants a copy of this, this is the British Medical Journal that shows, unless you're probably in your teens or early 20s, you just don't have the receptor sites for this virus. And you expel it and it just doesn't go anywhere. You don't get it and you don't spread it. Now there are exceptions, but the curve really doesn't start going up till you're around 60. Then look out. This is no walk in the park if you get this disease. But like I said, we're in a spot in the country where it's probably the least likely to acquire it. Now what do? This may change next week. We may have a surge. We're going to have graduation, and Scott and I have decided, let's have graduation. Space people out. Look the same. I don't know what we're going to do. Maybe have that mass. I don't know how hot it's going to be in there.
It's over hot.
That's
a guarantee.
I'm wearing a mask today just to feel what I'm trying to make this the fashion statement of the summer. Wearing a mask. It's tough, and if you have any kind of respiratory problems, it's going to really make you winded. But I don't think I need. Katie moved over towards me, so I'm wearing it. You know. But I think you guys are perfect. You're spaced out, looking away. The less we talk, the better. You know, the worst thing you can do is get a big choir together in a cold, air-conditioned room. That's you know, a petri dish for COVID. Outdoors, I think it's going to be well ventilated. It's not outdoors.
It's a Spartan Bowl.
But that's a big arena, well ventilated. They'll have those doors open. Everybody will have offered a mask. I think we ought to encourage them, but not mandate them. And
And that's how we're treating the plan. And, you know, we look at the new information from the governor, and we've had a couple questions about that. And we look at capacity of Spartan Bowl, we're going to be at 25% maximum capacity in there.
Perfect.
So for us, we'll have about 1,000 people because we're limiting it to 4 people per graduate. And we have some graduates who aren't walking because they either already received their diplomas or they have other
so
commitments.
much to it, man. I can't think of another building in the state that's that appropriate for an indoor graduation.
Mm-hmm.
That's my feeling.
Can you, this is a question that's bothered me for a while about this whole thing. As you had 4 kids, I've had all of your kids, thankfully, love Chrissy. That quote was so Chrissy.
She was gonna come.
The likelihood of a child contracting COVID-19 while at school, to my mind, is minuscule.
Right. It may happen. May happen.
It may happen, but statistically, it would be highly improbable.
Right.
There are no numbers that show it yet. I mean,
Okay.
And
there's
we have a
nothing to-
mechanism if it happens, and
So
can
we
address it.
don't have any data on
Correct.
that at this time because
Correct.
it's not happened.
Correct. There's nothing to show, there's nothing to show anybody, any numbers to prove that it's happened.
Leslie sent out a video for all of us last week. I can't remember the lady's credentials, but it said in that age group, first grade to seniors, child-to-child risk is minimal.
It is, and that's what we hear and read and see from what we've looked up so far. The article that he did bring is interesting, and it's
Take a
from
copy and pass it
Europe
on.
and overseas, which we've used it. It just shows that a little guy was a super spreader and went to a ski camp and was exposed to 150, 200 other children, and they didn't get it. And it's just an interesting article too that we've received from
It's
Dr.
just well done and
Yeah.
peer reviewed. It's what
And
everybody's using to,
to prove that they're not
and,
spreaders.
What was that website? I didn't get to
the
hear.
website is the Harvard Public Health Institute.
Okay.
Global Health Institute, Harvard Global Health Institute, just Google that, and it shows the tool. It was so popular yesterday, it wasn't up, it was just that, I'm sorry, we have an overwhelming response to this, because it was on NPR. I tried it today, and it's really neat, you can just hover right over it, it shows the trend of every county. And we are on the downswing on every, deaths, cases, ICU admissions, everything's on the downswing. Pretty much Indiana's got it going, we're okay right now, but what's gonna happen after the riots, after all the graduation ceremonies, after the fight, we have the Brickyard tomorrow or something?
But there's nobody there.
Yeah, but I don't know, it's just, it's gonna start, they're gonna search, but I think what we're gonna see is a bigger denominator. I don't think the deaths are gonna go up as much as the cases. They're gonna find it's out there a lot more than we thought, and the actual case fatality rate will drop below 1.
And that's gonna be the problem with the public, is they're gonna see the case numbers
Oh, yeah.
go up, and then they're gonna say, aha, my kids, and, stress, and that's what they hear in the media.
Can you address that? Because one of the things that, again, that's bothered me is the national media would make it sound like if you got this, it's a death sentence.
Right.
And there's no way to calm somebody from that when they constantly get a barrage of social media and news media that just tell you that COVID, 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 and that's all you hear. Unless you distance yourself from that, they're gonna soak that in. Are they gonna believe what we say? We can try to educate. If everybody says the same information and we get our education out there to the people with what we're trying, I'm not making any sense, but what we're trying to tell them, the right thing, if we just tell and preach and say the same thing over again and try to get the right information out there and calm the fear from what they're hearing on the media, that's our hope. Like, that's what we want to try to do, to tell them the right information, not the media fueled information.
The second page of this handout
I'm
says
getting
all
there,
this.
so.
That's all you need. And it talks about, contact tracing, hand sanitizer, and vulnerable populations, and masking. But I'm gonna hand this article out too. This is the goal, the Bible, the gospel of reducing transmission with, take one of those.
Speaker.
Let me grab one.
I'm so sorry. I'm trying to get out what I need to say, but I can't.
I just want to say, I think this is a great teaching moment for us.
Yes.
About kids and personal health and.
Well, I've been living and breathing this since March.
Yeah.
You hear one thing, and then when we first started out, masks were not to be used. Well, that was to prevent, taking all the supply. But now, they said, we need masks,
Masks
we
for
need masks.
everything.
Now we got them stacked
Like,
up
we
in
get the
the,
same thing that everybody else gets
yeah.
too.
And, but I think that handout that I'm giving you right now shows the science behind why masks work. And they're not for everybody, and they're not for children. I don't think it's a big deal. But if you're gonna be with a group in a restaurant or something, you ought to have it on until your food gets there, put it back on. Because it just keeps you, if you're an asymptomatic carrier, your little water droplets can infect somebody. But it drops by about, what does it say on the back, almost 90% drop in the spread?
By asymptomatic carriers?
Yeah,
Right.
it goes to it's on the very last page.
Oh, yeah.
Anyway, read that through, and it convinced me that masks were the answer, and about the only difference. In Thailand and Singapore, one of those two, they have like 1,000th the problem that we do. And what's the difference? They have masks and we don't. That's about the only difference. They do the same tracking and tracing that we do, they have the same treatments in the ICUs. But I've noticed over the last decade or so, every time you see someone from that area, they always have masks on. They must know something. But they went through SARS and MERS 10 years ago, and they know that masks in public drop the spread. When you drop the spread, then you decrease deaths. And we got a stall. I think this is a big stall until we get a vaccine or a viable treatment. With the flu, we have a vaccine, we have Tamiflu, and we have immunity, herd immunity With this, everybody's susceptible. That's why it becomes a bigger mountain, and the tip of the mountain is what people have problems. But that tip is a huge tip that's coming through the communities, and that's why it overwhelms cities that are highly populated. I feel sorry for, everywhere people like to go, that's where the virus goes.
Thank you. And I just want to say too, that this is being live streamed, and we have provided these documents on our webpage, and that's on the bottom of the screen. I appreciate John Palsy for that. And then also, we do have our FCSC Connect email that Kim and Cindy are going to be monitoring. If there are questions after we present information, we'll answer those if we can while the meeting's still going on. If not, we will have an FAQ document that's also on our webpage that we're going to keep updated with questions and concerns that come in. So that, we're going to try to be very transparent with this and answer questions as they come in. So let's jump into this, and I want to thank Dr. White especially. We met, probably a 2-hour meeting, the first one, and we've had really great support from him and from the health department staff. And I just want our parents and our staff and you all to know that this wasn't a decision made in isolation with what we've created in this plan. This has been hundreds of hours of work, research. We've listened to parents. I probably talked to 200 or 300 parents over the last 3 weeks or a month individually. And then the survey, we talked to staff. We've met with a committee of teachers, our Teachers Association, our administrators. So it's been a real team effort. You provided some really good direction for us when we first started looking at the possibilities. So I appreciate that. This has been a joint effort for our team. But this first page, we really debated where to put this, but we felt this was the first page because it really does cover the things that we need to address and we need to work with the PPE and practicing prevention. And something that Dr. White has said, and we've heard it from our school nurse, Kelly Gettinger, is, and others, is washing your hands with soap and water for 20 seconds or more. That is such a big preventer, keeping your hands off your face. So what Mark said is so true, is it's an opportunity to really focus on and educate our kids on those safe and healthy practices. And we're going to be putting a lot more burden and work on our school employees with that. And I think everyone acknowledges that, is our teachers are going to have to do their due diligence, and that's going to have a lot of stress to them and to our support staff and our administrators, just keeping kids as safe as possible. And so this plan, I want to go through it, and then I thought we would stop at different sections, and if we have questions, feel free to ask. And Dr. White, as always, either one of you, if you have input, I may seek out some from you, because we talked this morning at length and I was still asking you questions. So this document's changed 100 times probably, hasn't it, Kim, as we responded to this fluid situation. So talk about gloves. We have plenty of gloves. We will have masks. We did apply for an opportunity to receive them from the state, and they are supposed to be delivered before school. We have purchased masks through a bulk purchasing agency. A lot of people are choosing the cloth masks, but we are asking the parents, if you really want your kids to wear masks, then that direction needs to come from the parents and guardians, and direct the kids what they need to do. We encourage it when it's difficult to be socially distanced, but again, we listen to the parents, we listen to staff, we listen to our community, and we want parents to have that, and that may change. I want to preface that this could change, and there may be a mandate from the governor or president that we all wear masks, and if so, we'll comply with whatever federal or state mandates are there.
Indianapolis just did that today.
I know, I heard that.
On the gloves, gloves will be available for anyone concerned with touching papers, books, personal items, or money while employed by the FCSC. When touching papers, this is something as a teacher, you hand out a handout to the kids, you collect the papers. If the kids aren't wearing, are we gonna ask the kids to wear gloves, because that's not gonna work very well, or the teachers to wear gloves to collect them, which is also, what about the things that have to be duplicated in mass and passed out,
They're going to be available. Dr. White passed his papers and no one had gloves on.
And sanitizer.
I know. It's going to go back to
It's
teaching.
as simple as
that.
Okay.
The hand sanitizer.
In other words, teachers should not have to be
No,
concerned, because I do a lot of copying, a lot of copying for
Right.
teachers. And I want to make sure that I don't do anything that would be considered untoward, as far as, I get the master, I make 300 copies, I put them together for the teacher, I put them in the mailbox. You know, just the hand sanitizer,
sanitize before you start,
yeah,
doing all your stuff, put them in all your mailboxes, and then sanitize when you're done. And
Okay.
hopefully, if everybody else does the same thing, if they sanitize before they start hitting the buttons, sanitize before they touch the mailboxes, essentially, everybody's sanitized before they touch everything, and
Okay.
then it's a clean, and at the end of the day, the cleaners come through and sanitize the room.
So you have a spray.
You have a clean area.
okay,
And the greater concern might be for you.
Yeah.
oh well,
You know what like, that's the idea behind of it. You don't have to worry so much about putting on a pair of gloves and then make a copy and take off that glove and make another copy. Don't overthink it. Just, it's as sanitize and then do your stuff and then sanitize after and spray it down or whatever you decide to do for your disinfectant.
okay,
Yeah.
fine.
And same way in your classroom. If you were handing out papers to your children, squirt some hand sanitizer on your desk, pass out your papers, come back, squirt some more, and same after picking them up.
Okay,
Yeah, that's what,
And as we looked at what we wanted to put about that, I just wanted to make it known we did have those. And, you know, we talked, today I had a conversation about people with cell phones. You see employees at these businesses who are required to wear gloves, and then they pull their cell phone out of their pocket while they got the rubber gloves on, or they take money from another customer with the same gloves. So I think those rubber gloves give a false sense of security.
Yeah.
But for
That's
some
what I said.
people, that's false sense of security may be what they need to do what they're doing. Or if someone's collecting money at a ticket booth or something, we'll have gloves available just to address that.
could I ask Dr. White, realistically, what is the likelihood of getting the virus from
I started to mention, the
contact?
Gates Foundation did several studies on phone-like transmission. It's minuscule compared to the respiratory transmission.
Okay, in other words, the likelihood of getting something off a surface is,
It's pretty low. You've got to get like 1,000 copies of the virus, and that occurs with 1 breath at a foot or 20 breaths at 6 feet. You know what I mean? It drops like, you got to treat people like they're radioactive.
okay,
But the contacts, surfaces, every study I've looked at recently has really downplayed that kind of transmission. And there used to be, when it started, we were keeping your groceries outside overnight.
Right.
All that's gone by the wayside. They haven't seen enough transmission to warrant recommendation.
there's not been evidence to support that we need to do that.
That's right.
Okay,
And I wouldn't worry, that is the least of our worries, I think.
okay.
but those cleaning
Hand
and
sanitizer.
disinfecting still needs to be in place.
Oh, obviously,
Yes, yeah,
but we don't have to be.
right.
Okay.
Okay. We're checking some technical difficulties with TV3, so Kim was communicating that. So let me move on. So then the other section on this page is with the contact tracing, the hand sanitizer, and then the vulnerable populations. And this was information that we received from the in-class document. I think it comes through the CDC, but this is important information just with the hand sanitizer. And we're going to address that here, but we are working on purchasing bulk product that we're going to increase the number of hand sanitizer stations throughout each building, have them located at entrances. We're going to have hand sanitizer on our buses, cafeteria areas, but we're also going to continually reinforce washing your hands. Before kids go out to practice for sports, wash your hands with soap and water. After they get done, wash your hands with soap and water. And so it's going to go back to reinforcing, teaching, and sharing that same information with parents, that we need their help with reinforcing those good practices at home. And then we move into this. I added this disclaimer because I think it's important. Is that website working?
They're still struggling, but
Okay, there's a problem. If you're watching this live stream, there's a problem with that link to our webpage, but we do have these documents there. So we'll check on that after, but it's working on my phone, and is it working on yours, Kim?
Yeah.
So, I'm not for sure, but, you know, this is a fluid situation. So I want parents to know that, and our families and staff members to know that we may make changes in course, and that is probably the expectation. And I just want our folks to know that our plan is to start back on school on August 5th, full-time. And we're also gonna offer a remote learning option, and we are working on that now. Kim's leading a committee for that. So we will have 2 options for our kids and parents this fall when school begins. So I wanted to put that out there. We do not have that plan done, but she's working with teachers and administrators on that plan. So I just wanted everyone to understand that, because everybody's asking, are we gonna start back? That's our plan. If you approve that we will start back August 5th with a full-time schedule following the calendar that's been approved last year.
So we will be following the school calendar that we approved, because some school districts around us have canceled fall breaks, and,
My recommendation is to keep the calendar that's in place,
thank you.
because we don't know what may happen. Some districts are
It's all
building in 2 and
changing.
3 week breaks in November, but we don't know what's gonna be happening in November. So we may very well have to bring a change of calendar to the board to adapt to that, or if we get shut down by the governor, we will have to do that. But right now, the recommendation is to keep our school calendar as is, so.
Okay, good.
We will keep information updated on our school webpage, and that information is available there now. So I ask parents and staff to continually refer to that with updates. Student screening, and this has been working closely with the guidance from our state and from the Department of Health. And one of the key things we want all of our families to know is self-check your kids every day. We discussed the possibilities of checking kids daily before they get into our buildings or get on our buses. And we had some really good conversation with Dr. White about the thermal scan. I had that happen to me in a facility here where my temperature was too high. Well, I had been out in my truck for about 4 or 5 minutes on a phone call, shut my truck off, and I was really hot by the time I got in there. So I had to go and sit down and wait and then get it rechecked again. So I don't know if Dr. White wants to share that, but one of the issues with thermal scanner, when you have kids coming off of buses or they've been
We see
running to
that at our
school
door.
late.
We screen every person coming into the Whitewater Valley. If they're just, like, yet, this week, everybody's 100, 104, 100.4. But we let them sit there for a second in the air conditioning and they cool right down, so they don't, but I mean, that's the trouble if you're gonna have 100 kids coming off the bus trying to screen them all and then herd them all the febrile ones. Oh man, that'd be a nightmare. I think the important, what you just said, Scott, is that these are the symptoms you need to look for, and I guess the CDC just added a couple more: abdominal pain, nausea, and vomiting too. Is that on there?
No, it's not.
But, you know, it seems like if you're sick, you gotta act like it's COVID until proven otherwise. And there was, I got an email today from a Kim Kelly, somebody, the health coordinator, and she was wanting to know about what to do with people with fevers. Currently, it's 24 hours off of antipyretics, no Tylenol or Advil, and of course symptom-free, but afebrile for 24 hours, and then the recommendation from the CDC is 72 hours. I thought, whoa, that's 3 days without a fever. I think 24 hours is plenty. If you're asymptomatic, no fever for 24 hours without using Advil or Tylenol, you get back to school. And it's probably not COVID. Now, you start getting these other symptoms, they're not gonna come back to school with shortness of breath, fever. They probably need to talk to their healthcare provider and get arrangements for a COVID test. And then we can address what happened.
And we have gone with that 72-hour guidance, but, you know, Kim's making note of that because that is a long time when you're not using Tylenol or.
That was the guidance from the CDC for COVID. I don't know, that's a long
And
time.
that's correct.
That's what they said it did.
Yeah, and you just said 24 hours.
I just can't imagine
Okay.
somebody sitting at home, no symptoms, no fever,
That's a long time.
3 days.
and no.
For 3 days.
Yeah.
Well, that's.
Unless it's like a weekend, it'd be great if it was a weekend.
So is your recommendation to adjust that to 24 hours?
Well, we've always,
I know.
I've been at this for 30 years, we've always used 24 hours, and I don't see any need to do any different at this point.
Is that asymptomatic? You
Yeah,
said?
asymptomatic, yeah, you're not gonna send them back if they've got symptoms,
Right.
but.
I think it's important that we say that this is for our staff, our teachers, everybody, not just our students.
Everyone.
Exactly right.
Okay, so we'll make note of that recommendation from you then, Dr. White, that's okay with the board?
Yes.
And then the symptoms are there, and we will add the nausea and vomiting. Kim's made note of that, so we'll add that just so the board knows to that document in our community. We look at the academics, so we tried to break down the key areas, and you know, everyone, I want you to know, we could have had 100 pages in this document. And our goal was to really try to address the key areas using all the guidance we've had. And, you know, everyone can what if us, what if. And I've been doing that, and that's why I stay up at night, can't sleep, because I'm what ifing every situation. But these are the key things that we believe are the important ones to address in this plan. The physical interaction for partner or group work, we're gonna limit that, and that's gonna be really hard because so much learning takes place when you work with others. But that is something we are going to practice, is that social distancing piece. We're gonna need to see where our kids are. With the loss of 9 weeks, while we tried to do our very best with the remote learning, we are going to see where our kids are at, because we will have to fill in some gaps. That's going to be crucial with our kids. For students and parents not comfortable returning, or if a student is considered medically fragile, we will have My FCSC School online, and we are working on that now, and we will be providing more information in the next couple of weeks on that. And so parents need to be watching for that. But we are going to offer that because, you know, as I talked with Dr. Y, we may have kids who are quarantined for up to 14 days due to a family member being diagnosed or testing positive. And so we have to have a way to help support our kids during that interim as well, because that's 2 weeks of school for a student who really has no choice. So we are going to, I'm excited about what we're working on. I think it'll be one of the best out there with what we're going to be able to provide to our kids.
What is social distancing? Because and the lady that I heard this morning was giving an example. We have 6 feet for adults, but she was talking about a school desk, which is approximately 36 inches wide, and then just basically what, as a classroom teacher, I would consider a normal aisle type a normal situation. It's not 6 feet. But, you know, we've been so ingrained that it has to be 6 feet, 6 feet, 6 feet. There's some wiggle room on that as far as in a classroom situation. Is that what I'm understanding from a medical standpoint?
Okay, that goes to the studies that showed that the rate of infection goes up sort of exponentially when you get in that 6-foot bubble, inside that 6-foot sphere. Outside it would just drop off to almost negligible. Now, I've seen studies 3 feet is acceptable. You know, it just kind of varies all the time. But I think the key is to stay as far away from each other as possible in the rooms. Limiting, aren't you limiting the class sizes somehow? I'm not sure what that part is. But 6 feet would be great, but I think 3 is adequate. You know, if you, like, this probably is adequate in a classroom,
Okay.
you know, with not a lot of talking interaction, but that's not good if you're sitting at lunch and you gabbing back and forth.
And every student facing forward.
Yeah, exactly. It's the talking is what that spews out the aerosol.
Like the circle reading groups, try to stay away from that. The in your corners where all the kids get together and they sit real close to each other while the teacher reads. And you see the kindergartners that did that when they were little, you know, try to keep them away from that, I think is what they're trying to stay away from.
And we're going to address that with the seating too, but we are, you know, I have gone to different buildings and looked at classrooms, and we've laid out what furniture looks like. Trying to get desks about 5 feet apart is pretty realistic with what we're doing on a regular basis, but we're going to have some areas where we'll be able to do 6+. But the key, and that's something Dr. Whitey shared, is the length of time they are in closer proximity is important too. So we're going to really try to limit those times when kids are required to be in close proximity as another way. And we're gonna need our students' help on that, and we're gonna need our parents to help reinforce that as well. Because
What is that timeframe, that of close proximity?
15 to 20 minutes.
15, 20, 20 minutes maximum.
Right. So no more than 20 minutes at, you know, close face-to-face time.
Up close and personal.
up close and personal, right?
Right.
So that's the academic piece. Then the attendance, we are going to not conduct or have the academic or the attendance rewards and recognition programs this year. We're just not gonna add that level to our kids or parents that we don't want them punished if they have situations with the COVID-19. Our current attendance policies that may penalize kids when it's a COVID-related issue, we will not, they will not be in effect during the pandemic, and we do ask for parents to keep us in the loop on things and communicate those things with documentation, just for our records, but we are going to be as flexible as we can with any COVID-19 related absences.
Children that are excused because of COVID-19 will not be required to make up the time.
Correct.
Now, we do want to offer an online, if they're out for 2 weeks,
Right.
we are going to move them into the remote learning option where they can
Okay.
join classes and do some things through distance learning for that time, because that's too big of a gap for
Right.
kids. So we will have that, and then kids will be able to make up missed assignments and tests and things like that too,
Okay.
following their policies.
Can I ask a question? This might be for you, Wayne. If you have a parent of a child test positive, they're not a teacher, they're at home, whatever, so those children have been exposed, and they're in a classroom. So those children need to be out of school
Right,
until parent
is clear.
cleared, and the child may need to be tested.
That's correct.
And then what about all the kids in the classroom? What would you recommend?
Exactly.
Nothing?
Not the kids in the classroom, but that's the big thing. Oh, somebody just tested positive, shut the school down. I don't agree with that.
Okay.
Is that what happened?
That's what happened, yeah, that's what we run into that today, and I think we had decided because the child would obviously need tested, we would recommend,
Okay.
just to, you would have to know whether or
Right.
not they're positive or not. If they're positive, that leads into a whole nother door that you would
Right.
have to go down, and then you would have to deal with the classroom, alerting everybody that route. If they're negative, they need to just stay home in quarantine for the 14 days, watch for symptoms,
Along with the parent who's
along
home.
with the parent, yeah, and then come back to school like
And
normal.
then the parent who's, must be symptomatic for whatever reason they got diagnosed, it's 10 days after onset of symptoms and 3 days without fever, the 72 hours. That's where that came
And
from.
doesn't it have to be 2 tests, 2 negative?
Or you can have 2 negative tests 24 hours apart. Say
Okay.
somebody comes in and they were just like, I went down and got my test today, lo and behold, it's positive. Well, that could be a false positive, but these tests are pretty good now. They were a little sketchy at first, but they are about 98, 99% sensitive and specific now, so a positive test probably is positive. But anyway, I could, in 4 days, return to work if I got a test tomorrow and a test the next day, and each one takes 2 days. I get the first test back on day 3 and the second test back on day 4. They're both negative, I'm back to work. That's what happens. And then, but it's all off, all bets are off, you're still symptomatic, that's a whole different ballgame. You wait 10 days after the onset of symptoms and 3 days without fever, without pyretic, or Advil or Tylenol.
What about if you have an adult that's in the building that tests positive? And they're around all these other adults?
Oh, I know.
That's a little trickier, right?
It is, that's what happened at one of our nursing homes. You look
Yeah.
sick, you better go get tested. This time he infected 22 of the 24 people in a wing.
Well, in this
Test
paper-
everybody.
Oh, thanks. I found, I don't know, this is probably something that Mr. Collins has found when he was looking at all the other stuff. It was on the CDC website, and it basically
Oh,
said
yeah.
when a student, faculty, or anybody, when they can return to school, and it's supposed to give you the individual scenarios and what to do when they have symptoms and when they're asymptomatic. So maybe that might direct your path on what you decide to do when that happens.
And also another question, so if teacher A gets sick and is positive, and the next day, everybody in that school building, any adult that was in close contact goes and gets tested. Are they necessarily gonna be positive that, could they get the I mean, does the virus stay for a while before it shows up? So if person A is tested on Monday, they get the results Wednesday, and they notify everybody, hey, I'm positive, so all these people go out on Wednesday, and they get tests back Friday that say negative, there's no chance the virus is sitting, you know, like how sometimes it takes a couple days before it shows up?
I know where you're coming from, and I can't really address that. No one knows.
Okay.
I mean, it's symptoms and close contacts that you've talked to. You should be able to, I guess I have a hard time thinking back 2 weeks who I've been around.
I know.
But when that guy became positive, or the employee became positive, you should be able to narrow it down to a few people that need to be watched closely.
Okay,
And that's what we did at the nursing homes.
okay.
We ended up just testing everybody. There's only 6 people that were affected by that worker.
And that's why they emphasize close contacts, because your close contacts are the ones that you
Talk
are
with, you're
within 6 feet
taking breaks
of
with.
for 20 or more minutes.
Okay.
So your coworkers,
Passing in the hall doesn't count.
like
Okay,
this.
We're not gonna shut the whole school
Okay.
down.
Right.
That's really
do not
helpful,
count as
thank
a
you.
close contact. It would be your people that you live with, the people that you share an office with that may have a desk closer that you share the same airspace with for 8 hours a day. It's not the people that you pass and say, hey, how you doing in the hall?
Okay,
Right. They want to know the close contacts that you share breath space with.
okay, thank
So
you.
that's what we would take into
And
consideration.
we're there to, I think part of the algorithm when that happens is to call the health department, and we will, case by case, figure out what to do.
And you
Okay.
trace back each one.
That's what we've done for all the businesses in town so far.
Right.
We get calls all the time when somebody turns, well, we've had 96 positive cases that, besides the clinical.
Right.
You know, some people were diagnosed by clinical symptoms, but that didn't count, I don't think. That was before we had lots of tests available. And I want to remind everybody, the Optum test site is just, they're,
Oh, I have that too.
we're ready and waiting.
Sorry.
And they-
That's the one that, and it's free testing,
It's
right?
free, I've had 5, and you walk 10 minutes door to door.
And they, I printed that out so everybody can have one and tell everybody
We wanna
about it if they
keep
want
it
to
going,
test it.
because we don't want to lose them. If they start losing
Right.
volume, they're
The
gonna
state-
pick up the,
Sent people down to test, and you need to register to get a patient number, and all you need is that patient number, and you can walk in between the hours of 7 and 7 to be tested.
Great,
So
thank you.
So anybody that has any serious concerns about exposure,
get it.
we can send them down, all they have to do is register and get tested
Yeah,
right
once you get your
here.
number, don't
Right.
lose that number. If you move on the website, it goes away, and you can't go back to that page, so
Okay.
take a
Make
screenshot of
sure
the
you
number
get
when
a-
you get the
keep
number,
your
that's your,
patient number,
that's the
and
only way
that's all
they
you
know
need.
you're an Indiana resident of Fayette County, you know, they know how to get a hold of you, they've vetted your insurance, but they don't bill the insurance, but I didn't even put any insurance on there.
Right, I would just skip the
Don't
insurance.
just skip
right?
that line, that's just part of the form.
But they will ask you if you wanna make an appointment, don't make an appointment, just once you
Show
get that
up.
patient number, stop, write it down, and then go down to the
And
armory
you get one every 24 hours,
Walk in.
free of charge.
So you don't even need an appointment then? for
I didn't have an
I didn't know that.
Well,
Okay.
I just found that out today.
Okay.
So that's new.
Mark, did you have something?
Yeah, I just thought, thanks for this, and I thought the parents, somehow we're gonna get that to all the parents, I hope.
We've got information in our plan, but we're gonna add that to our
Yeah.
links as well. Cindy will add that.
Thank you, I thought that was a
It
real
was.
good.
And the little
idea.
comments on there, stars that you made help too. So let's go back to, just to keep us moving along
Yes,
here.
thank you.
We are going to one-to-one as a district. I think I mentioned that. So all of our K-12 kids will have a device, which is really important. We are going to arrange seating, as I shared, socially distanced. I used Kerry Brown's room as a room at the high school because he was in there. He's in there pretty much every day, it seems. And Randy Judd and I and Kerry spaced desk out in his room. And his classroom's a typical 900 square foot classroom that most of our buildings have. And we were comfortably able to put 25 seats in there, facing forward with spacing that was adequate with the social distancing. Now, some teachers are gonna have to declutter. We're gonna have to remove some tables and extra furniture out. That's gonna be hard. You know, I talked with one of our primary teachers on this committee, and she realized, I'm not gonna be able to bring all my kids back to the carpet and do stories and activities where they're sitting shoulder to shoulder. I said, no, but we can still find ways for kids to sit, but they have to be socially distanced. So we have to do our due diligence on that, and that's gonna definitely add a whole layer, especially with their younger kids, because they find each other, and so do our high schoolers. But lockers, the third point, we are still working with Brian Todd and Randy Judd, our middle school and high school principals, on how we're gonna manage lockers. What we found, that our high school kids don't use their regular lockers a whole lot. When they had to clean them out and bag the items up, not very many kids had anything in their lockers in the hallways. PE lockers, we still need to make those available, but we're really gonna stress to our kids, you have access, you keep it locked, and, so that's gonna be something we'll continue to work through our administrators on, but we are aware, we don't want the kids socializing and gathering at the hallway lockers. That's
Okay.
gonna be a
We
big
have
factor.
something in our policy about carrying backpacks, and I remember this from the middle school. So we can't do it both ways. We need to change that, because, when we were very concerned about contraband coming into the school and the kid having it all day, we had a no backpack rule, and which is still in effect. So that's something we
And
need.
that's why I didn't want to say we will or shall, because we may still need to use them. Most high school kids carry their belongings
But
with them
they
nowadays.
they don't have that restriction.
I know, so that's why we haven't decided how we're gonna handle it, because we may just limit the times kids go to their lockers in the middle school, so it's still a work in progress.
Okay.
So, but that is just an area, we're trying to look at congregating and where kids hang out and be not socially distant, so that's still a work in progress.
I
That's
think
why
without water fountains and the kids carrying their own bottles and everything, that it would only be natural to have their own backpack, keep their own
Right.
stuff in their own, plus their water bottles.
Yeah, so, and we'll get to that part too. And then we're gonna try to mark floors when possible to try to help remind kids about the social distancing. We're gonna try to make hallways one direction. Next week, I'm gonna meet with our principals, Kim and I will, to look at how we can make some stairwells at high school, middle school, one way. Don't know how that's gonna work, but we're trying to look at creative ways to prevent the crowds and the flow of two-direction traffic. That's on our radar. So we are working through that. Cafeteria, we'll address that in our food service plan, but we are going to we have a great plan in place with Chartwell's. Being a national company, they have people from their corporate office that have been working on this since March. The drill guidance, the state has given us a little leeway with all the safety drills, with fire drills, lockdown drills, tornado drills. So we are permitted to do a little bit more preloading or preparing our kids for that, and we will slow them down, because the goal is for kids and staff to know what to do. So we're taking that time element out of it so we can keep kids distanced and get them safely to the areas where they need to go. And if it is impractical, let's say for a lockdown drill, for the kids to go to that, teachers will reteach and tell them this is what we do. So it's going to be key on teaching and educating. And if there ever is a situation where we have a real drill, the social distancing worry will probably take a back seat to getting our kids safe.
Yeah.
So I just want to be sure you all work.
So that, basically speaking, we will not have tornado drills then?
We will probably just educate and tell them where we would go and what we would do. Yeah.
Because there's no way.
We can't put them into
No.
tight spots shoulder to shoulder.
No.
So, yeah, and that's the leeway that the state gave us, so we're gonna follow that.
Okay.
Entering and exit schools, we are gonna have hand sanitizer available at each school building entrance and throughout the buildings. We're really gonna work on trying to keep congregation of kids to a minimum. We are gonna post signs throughout our buildings, just reminding them of good practices and good hygiene. Our custodians are gonna have a tremendous amount of extra duties on them each day with keeping the high traffic areas, the frequently touched door handles, things like that, clean and sanitized. So, that's gonna be a big task. And we are using some of our CARES Act money from the federal government to purchase backpack type of disinfecting wands that mist areas and it's a product that will kill the COVID virus, and each school will have one of those that we can use to sanitize playground equipment before kids use it each day. wrestling mat, I mean, all those areas that it would be tedious to try to sanitize and clean in a quick manner. We're gonna use them on all of our buses every day to sanitize the buses between routes. So Brian Hensley's been working on that, and we have the chemicals that are coming for that, and we will be training our custodians to do some big cleaning, but also they're gonna do a lot more just sanitizing with approved products that are for COVID-19.
I have a question on door handles. A lot of businesses now, partially because the weather is so nice, actually have their doors open. Are we going to encourage classroom teachers to keep their doors open if they're on a main hallway? It seems to be 6 of one, half a dozen of the other, but that would keep that door handle from being touched so frequently. Just keep the door open during the day. It's gonna be open during the passing periods anyway, to just limit the amount of contact that was gonna be made in opening and closing that door.
That's one strategy we talked about, and even looking at our restrooms. You know, with most of our restrooms, the doors are typically propped open because you can't see into the restrooms, but those are some of the areas that we want teachers, that's a recommendation from us. There may be times when they're testing or doing something where they need to shut their doors, but that would be another strategy available with leaving them propped open. Food service, we will have a section at the end that is covered in this, but washing hands, again, it's reminding kids to wash hands before and after lunch. Soap and water is going to be big. Using hand sanitizer. We are not going to allow sharing of food during the school day, and that's typically something that we will always stress, but sometimes kids like to pass that banana over to somebody else or a Pop-Tart, so we're really going to be stringent on enforcing those rules. We're not going to have the food items where kids may not eat a prepackaged item and it goes back into a container where it can be recycled, reused by someone else. We are not going to do that during this time. So we will see the waste of food increase, unfortunately, but that comes on the recommendation of pretty much everyone we talk to. We are going to limit outside food deliveries from restaurants, at least for the first semester, just because that's one of the recommendations we have is outside food and things being brought into the building that we don't know where they've been. So we are going to take some steps there where we're really going to try to limit those deliveries during the first semester.
Do kids still bring their own meals?
They can still bring their own, but only they will be handling it and touching it, yes.
Does this apply to athletic teams that typically would have a restaurant come in and cater?
Really, we really need to keep as much in-house as we can during
Or
this time.
parents who provide meals and snacks for the sports team?
That's gonna be something that will have to be, we're just gonna be very cautious right now with
Yeah.
that. Just so we know, because everything that, and this goes with athletics, and it's in the athletics plan, but food that is to be sold for games once sports will start back up, has to be a prepackaged. And that's gonna be a big change for people, is at this time, you're not gonna be able to go and get that open tub of popcorn, as much as I love the popcorn at our ball games, or it's gonna be prepackaged items for now. And so that's gonna be a change for folks too.
So we get prepackaged popcorn.
Well, that's what we're gonna have to come up with alternatives, yeah. Protecting the vulnerable high health risk students and staff. We will have a point of contact with the health department, and as Wayne said, we are going to go to them. They are our point people on any related issues with COVID-19. And we're on speed dial now, and we'll continue to be that way. And he's been responsive day or night so far, and I know he'll continue in his staff, so that's really valuable. Hand sanitizer, you'll see that theme a lot. We're going to be investing in hand sanitizer by the 55-gallon drum. All vulnerable high-risk health students and staff are encouraged to wear their personal protection equipment. That's something we're going to continue to reinforce. If you feel that it's not safe, bring your mask, wear your mask. We are going to offer the remote learning option, and we had a question that came in. I just want to visit this here for a minute. One of our parents or patrons asked about the remote learning. Could we hear some more about it? First, is there a fee? No, that would be covered. If you're enrolled in this program, there's no extra fee other than your book rental and what a typical student would pay, but there would be no other cost if you enroll through our program, because we're going to do some creative things bringing the classroom to you too. So I wanted to answer that question. We don't have all the details, so I don't want to get out there too far ahead of things until it's been vetted through with our teachers and our administrators. But that's a big task for Kim to be working on, and she already has started. So I wanted to answer that question, and thank you for that. The early transition times, this is something that it's going to take some real finessing at our middle school and high school, because traditionally that schedule operates pretty much lockstep on that bell system. And next week when Mr. Judd is back, we're going to start talking about how do we provide flexibility for kids who may need extra time or doesn't need to be in that hallway when you have students moving together. So we're looking at how do we plan for kids who need to travel when the hallways are occupied by a lot of kids. So that's going to be a part of the plan on a case-by-case basis too, to help support our kids.
We've done that before, though. We've had delayed passing periods anyway for highly vulnerable kids or for kids with behavioral issues in the hallway. So it seemed to be just a natural extension of that.
Right. So I just wanted that to note that we have considered that and we'll address it. And we're really going to try to limit large gatherings and interactions whenever possible. We have some big spaces in our schools, and instead of the choir maybe on the risers or in the choir room, they may go in the auditorium spread out to set in the seating, or a band. So we're going to use that, the field house. We're going to try to maximize our spaces. And and I told the group of teachers we met with on a committee that looked at this plan with us, is you go outside on nice days. Take the kids out and let them sit a few feet apart and go outside and listen to whatever lesson and engage. So we're really going to encourage that whenever we have opportunities to spread kids out in large groups, that they're spread out in big spaces. But that's going to be our focus. Some of the things we've done, we won't be able to do right now with some large gatherings. Recess, that was a big question that came up with a lot of parents. Kids need recess. We are going to get our kindergarten through 6th graders out for recess, and our preschoolers. We are going to stagger times. We're going to have to change some schedules, and we're going to have to sanitize the balls and jump ropes and equipment between use. So we'll have supplies for the adults out there to be sure that's done. And then, like I said, we will sanitize the playground, the climbing equipment and swings every day before the kids use it, because you don't know who may go out there in the evenings or after hours. So we are going to take those steps too. We are going to limit contact games, tag and things like that until further notice, just because we're going to really try to limit that physical contact in the close. But we are having recess, and that's important for our kids.
And
But that's
kids
the
will
plan.
be washing their hands
Before, after.
when they come in from recess.
Social emotional learning, I don't think any plan is good. We have to prepare for the effects that this has had on our kids, and some staff too. And so we are working, Kim works with the SEL team, and I just wanted to put a few bullets that they have been working through. This is a whole nother piece that's being developed right now, but we have to support our kiddos, because this has been really hard and traumatic for a lot. And for many children, school is that one consistent in their lives every day. So this is definitely a big piece of our radar, and our neuroeducator Ashley Steffi and our counseling and social work team will be working through this with Kim and Megan Gilman. So I just wanted to add some pieces. I'm not going to go through each one at this point, but it's definitely a big piece on our radar to support our kiddos. Special events. Convocations, we're really going to be cautious. We're not bringing the whole school into the gym for a show with animals or some guest until further notice. Field trips, we're going to put a hold on those. We don't want to send our kids to Indianapolis to the zoo or to the Children's Museum at this time. So we will have some flexibility possibly for in-county places where we know that the environment's controlled and it's our local community and we have social distancing. So I wanted to give Kim that flexibility to approve some local things if possible, but we're really going to be cautious on anything
So
out of
if
town.
somebody wanted to take a field trip to the Mary Gray Bird Sanctuary, for example, this
Right.
would be okay.
Or if a class wanted to go to the park for some learning activity.
Okay.
But we wanted to leave enough flexibility, but yet we're really going to be careful sending our kids out. The Washington DC trip for our middle school is canceled. We made that decision because there's too many unknowns. So that's already something we had to address, just for the money and getting it back. Classroom speakers, we're really, as much as that is such a valuable part of our school, we're really gonna be careful on who comes into our building as guests, and then family nights, because if you've been to family nights, it's a mass of people, and the hallways are packed, and we can't control that. So for now, we're putting a hold on those. We will reevaluate those second semester, but I know that's a big deal to our school, especially our elementaries. So that's gonna be a whole, school open houses, we need to get our new kids and the kids who have been transferred into their buildings, so the principals are going to work on that with plans on how to bring small groups and individuals in, because we think that's very important. So that's gonna be something our principals will work on. Transporting students. We would need to buy about 50 buses if we put 11 kids on a bus. And Wayne, we had a big conversation on buses, and he actually brought the idea to us, and I give him credit with, how do we load our buses? The first step is we want to keep the seat right behind the driver empty. The only exception would be is if we have a student who needs harness, we have safety belts and harnesses in some of our seats. If that's the case where it's a safety issue, we would use that seat. We are not allowed to install plexiglass partitions with our bus drivers up to, that was one idea, is to put a shield up. We are not permitted to do that for safety reasons. So, we are providing masks. If our drivers want to wear shields or masks, they have that option. I've talked to probably 15 drivers. Most don't believe that they will probably do that. But again, that is a recommendation, but we're not mandating that at this time unless we're told differently down the road. We will have hand sanitizer on all of our buses. We provide for those, and we will be assigning seats. And so the idea from Dr. White was we fill in front to back every other row, and then we put family members together if they're out in the same household, and then we fill in those other seats as we get to the end of the route. So that contact time is minimal. And that was the idea that he said, that I thought that makes sense, because Daryl Drew and I, we were really, how do we get our kids on our buses in a safe way? But we cannot manage 11 kids on a bus if you skipped every other seat and put one per seat. So he, I don't know if you want to share anything.
You'd fill the back first.
We would fill the back first, yes.
I said front to back, but.
No, I'm sorry,
Fill
back
the
to
back,
front.
every other row with assigned seats, and then start again, filling in between, at the end of the route.
Right.
They'd be the least, lowest time together.
And then you could put families, you could put 2 kids in a seat and 2 siblings in the same seat.
Yeah.
Yeah.
Same family would be all right.
Same family.
And I had a mom ask me the other day of 2 young kids, and I asked about buses. I said, well, we're working on that, and I shared what we were working on, and she said, my 2 kids will kill each other in the same seat. I said, yeah, but your principal's only gonna make 1 call then. So it was funny, but she was joking, I think, but I said, those are the safety measures we're taking. So I talked about the face mask, and then we are gonna recommend if students bring masks and wear them on the bus if you would like to do that. That's a recommendation that we have. So we want to give that to the parents to make that decision for their kids in the sim mask. We will work on bus unloading to try to stagger entry into the building, so all 8 buses at one building are not unloading in one mass of kids. So we're going to try to stagger that, which may cause some adjustments to our official start times in our school by a few minutes, but we're really going to try to be purposeful in letting kids go in and still maintain some spacing. So it will take a lot more work and effort on our staff's part, but we have to be diligent in entering the building and exiting.
What about the children whose parents bring them to school? Do we have a plan for where those children will go once they enter? Because a lot of parents do bring their kids to school and they congregate outside or in the common areas.
Again, that's going to be reminders and signs of socially distancing. And for elementaries, we'll just have to spread them out more wherever we congregate them. We talked about that. We may not be able to fit all of the kids in a gym with social distancing. I believe more parents will probably deliver their kids to school and bring them than what we've had in the past, and I encourage that. Parents, if they want to drive their kids to school and pick them up, we'll work with them. But if we do have a large number of kids being dropped off, we'll have to modify and adapt those plans of each building to make sure that there's enough spacing for the
And
kids.
modify the traffic flow so parents are not in line for exorbitant amounts of time.
We don't know what it'll look like until we start, but
Yeah, okay.
yes, definitely. Visitors, if it's not an emergency, we're asking parents to help or guests to try to check in before. If it's not an emergency situation, we are going to arrange the offices to allow for visitors and try to protect that space between our office staff and our visitors. We'll continue to sanitize those high-touch areas throughout the day, and we're really gonna limit visitors in the building during this time. We're gonna be very cautious. If a parent's coming in for a conference with the principal or special ed conference or something, we will just take extra precautions with making sure they're sanitized and checking with them, do they have any symptoms too, and being cautious. But we can't not allow visitors in, but we're gonna be very cautious on people coming in for lunch. We're not gonna allow parents to come in and eat in the cafeteria at this time, and steps like that, just to be cautious. Another big one was water fountains. That's a tough one because I've been in schools long enough, a lot of kids put their mouths on that fountain spigot as much as you tell them not to, they do. And so we are going to disable the spigot part where you put your mouth to drink. We are purchasing a large number of the bottle filling stations. We have some of those already in place in some of our buildings, but we're going to make sure that there are adequate numbers of those where kids can do the touch-free, fill their bottle up, and go that way. We'll also have water available in our cafeteria for kids as well. We're really looking at ways where kids don't touch, they don't push that arm on the water fountain or get their mouth close to that area. So we are going to disable those, but we will have the filling stations.
Will there be an opportunity, I'm just thinking some of our kids may not have water bottles?
Yes, we're working on that one.
We're working on that.
Figured you
We're
probably.
gonna probably use some CARES Act money to get water bottles and
Good.
put permanent marker names on
Right.
them. Yeah,
Thank
we've
you.
We'll make
already,
sure everybody has one.
we wanna make sure everybody has something that they can drink out of.
Thank you.
So a lot of high school kids already in middle school, they carry these around.
Yeah.
But we wanna make sure that our elementary kids
Yeah.
have something that's theirs and it's kept sanitized in a safe place and away from others touching it.
So, on that, would there be a way for those kids to leave their water bottle at school so they're not?
We haven't worked that out, but we talked
We've
about
talked about it in like,
whether it's big Ziploc bags or something where they can stick theirs and put it in their desk.
Yeah,
We're working through that with
okay.
principals, we just
Okay.
haven't had a chance to get through those little details. But
Yeah.
yeah, we need to put a place where it can be safe because that,
Maybe give it a
we have to
day.
clean desk every day. So desktops will have to be cleared every day, so they can be sanitized and clean at night. So we're working through that. Good question. When a child, staff member, or visitor becomes sick, I don't want to spend a lot more time because Dr. White has shared it, and we will put the resource that they provided to on our webpage. But we did try to lay out all the procedures following the recommendations from the CDC and in talking with Dr. White. So there's a lot there. And then we have the decision tree, which we included in our plan. Did you want to say anything about that?
Well, you gotta put a plan down and look at the data, and it may change tomorrow, but right now, I agree with this.
Okay. Added two more sections, just because I want everyone to know that the IHSAA and the state has said that sports can start back on a very limited, restrictive method Monday, July 6th. And, that's part of the plan because I want to be sure the board's aware of what the plans are. Brent and his team have been working on this, following the guidance. And some of that is going to be the daily screening of kids, especially in these early days with this, with just opening things back up and starting to, is they're going to be checking kids daily, temperatures, if they exhibit symptoms, and then, if kids are vulnerable or high risk, we're asking they probably don't participate in this phase 1 step. So we're trying to be cautious. So that first phase will run July 6th through the 19th. And we will not be using locker rooms at this time. Students should be coming with their clothes on for workout and then go home, shower, launder those clothes, Football's not gonna be out there touching each other or doing anything. Everything's gonna be socially distanced during stage 1. So there are gonna be a lot of precautions that are taken. Even kids, you go into a gym, you see all the backpacks or equipment thrown on the front row of the bleachers. Kids are gonna have to spread that out. They're not gonna be able to throw their items on top of each other. No celebratory action. We're not gonna be going out there doing chest bumps or high fives at this point. That's restricted throughout these first 3 phases per the IHSAA. We will have restrooms available, but not locker rooms, and I want to be sure that was clear with that. And then we're going to continue to stress washing hands, sanitizing hands frequently. Athletic trainer will certainly be an important part of this in assisting, checking temps, making sure that areas are clean and sanitized daily. And, our trainer is provided through Reed and does a great job. And so, she'll work with Reed on any issues there too, and we'll work with our health department. Something that we're gonna stress with all kids, don't touch your face. And what I found when I wear a mask, I touch my face a lot more, so it makes it even harder because it's something I'm not used to. So we have to encourage kids not to touch your face, mouth, eyes, nose with unclean hands. We're really gonna limit where coaches are and try to keep them in their designated areas for workouts. And we're really gonna focus on skill development with as little contact as possible during the next 2 weeks. Encouraging hand washing, you'll see that theme come up a lot. Wash your hands, wash your hands. No sharing of drinking. I don't know what you call it, the cart that you have all the spigots, those aren't gonna be used. Kids are gonna have their own water bottles. Keep those safe, not share anything like that. Kids won't be drinking out of the same containers. Phase 2 will start July 20th unless plans change. Locker rooms, meeting rooms will be at 50% capacity. Still asking kids to come dressed to work out. Go home, shower immediately after, launder their clothes right away. No sharing of equipment, clothing, shoes, towels, etc. Still maintain social distancing, and no celebratory action still. No high fives or hugs or
So
whatever.
when school's in session, because it starts before August 14th,
Yeah.
for kids that are changing, they'll change in the restroom?
Well, the locker rooms will be 50, that just means that we won't have 60 football players in there at a time. The
Okay,
coaches are gonna have
50%,
to,
so they
yeah.
can, okay,
Yeah.
okay, yeah.
So then the weight room, we will be able to have spotters, but we're just gonna have to work on social distancing, which is gonna be hard. There's gonna be a lot of sanitizing of equipment. And if you go to one of the gyms here in town, that's a big deal too, is sanitizing and keeping the equipment clean. So we're gonna have to practice that.
That's great, they should help a
Yeah,
lot
we'll,
with that.
we'll use that daily in those areas. Phase 3 is August 15th, and at that point, competition can begin. Again, there's not supposed to be high fives and hugs. I don't know how you don't have contact for football, I haven't figured it out yet, but, I don't know what we're doing there, but at that point, you can have contact sports according to the IHSAA. Spectators will be permitted, but social distancing is still requested. Concession stand will serve prepackaged items only. Restrooms will be cleaned more thoroughly during events. And then we'll ask our ticket takers to take precautions. Water fountains will not be used, so people will need to bring water bottles or purchase their drinks through the athletic department in the concessions. And then we won't share any watering systems or bottles still. Well, that'll be a practice that probably won't change forever, maybe, I don't know at this point. And then included in Appendix 2 are food service program guidelines. Meals are such an important part of our kids' day, and we provide many kids 3 meals a day, and we have to be sure that we still meet their needs. Chartwells will be investing in banners and signage to help remind kids. They're gonna place stickers on floors with the serving lines to try to prevent that congregating when you have kids standing shoulder to shoulder. And then their staff's gonna help monitor that along with the principals. So it's gonna be a training and teaching our kids what to do and really getting them in that habit. They will have plexiglass at all their cashier stands. And what we've been doing at the high school, kids have their ID numbers that they enter into a keypad. They're gonna go back to ID cards that the kids will scan, so we don't have that high-touch area with pushing buttons. So that was an idea that we came up with that they're implementing, and that'll help with the frequently touched areas. Some big changes with what kids receive is they're not gonna have self-service, and if you've been in our cafeterias where we have the buffet style fruits and vegetables, we're not gonna be able to have shared utensils to scoop out your vegetables. So all items will need to be in individual wrapped cup items for kids to grab and go. They won't be able to serve and scoop their own items. We'll do boxed and plated foods whenever necessary. We have condiment pumps, like ketchup and mustard, which are great, but we're not gonna have those. The kids will get packets that will be handed to them. It's gonna be a contactless point of sale. The only thing they might pick up will be the prepackaged items that they handle once and then go on. That's the goal. But we're gonna do a lot more serving of the kids even at the high school.
I have a question that doesn't involve food service, but I just thought of it.
Yeah.
So our kids that are in our special needs classrooms that
Need assistance or?
yeah,
Mhm.
that are gonna have touch. I mean, I'm sure those are a little different scenarios.
And a lot of those classes, utilize, kind of like the family meal style in their own classroom. They have their own tables and chairs that they
Yeah.
sit at every day because they like the same place. And so, there are some of them that go to the actual cafeteria with their peers, but a lot of them eat in their classroom, so it'll be easier for us to keep those areas and the touching down for those.
But I mean,
classrooms.
you've got kids that occasionally, an adult has to hold them and
Sure,
those
sure.
kinds of practices, and that's really safety related a lot
Yeah,
of
that's
times.
safety related.
And I think that's safety related, we are going to do what we need to do, but I think that will be more precautions taking where it is in a touch area, like in a life skills class or where a child needs that. We're just gonna be sure that our employees and kids are checked more closely and really reinforce those hand washing, maybe masks that need to be worn in times in those areas. Had a great conversation, Megan Durstein, is also our deaf and hard of hearing teacher and is a life skills teacher, and she said, the kids have to see my mouth. And our speech teachers, so we will be buying the plastic shields for some of our teachers whose kids need to see their mouths move if they have to do close contact things. So they are thinking of all those things and things I haven't even thought of. So that teacher input's huge with how do we protect our kids and staff. So that's just an example of that. That's a good question, Leslie. All employees in Chartwell serving food will wear their masks and gloves. A lot more wiping down of high traffic areas, even stepped up more. There will be no sharing tables or food rescue program, which saddens me to see the waste, but we cannot take a chance on that. And then, of course, hand sanitizer. So that is our plan. I shared it with our health department, and we really worked through it and gotten feedback from a lot of people. And we need to get our kids back to school, and that's my recommendation to the board. Dr. White, is there anything else that we didn't cover that
That
you
was the
think maybe?
thing I heard this morning from all the other health officers in school districts around, we just get kids back to school. The harm of leaving them out or closing school is way more than this COVID virus will do. And feel free to call our office at any time. Katie and Megan couldn't be here tonight, she's on vacation, but we will answer any call.
I have one more question. I have a couple here, or I have several, so can I get to these questions? These are from patrons. Dr. White, this is more for you, I guess, but does a school district have a plan to obtain test kits if Optum pulls out? I don't think schools will be able to provide any type of testing. Do you want to speak to that?
Oh, I just got an email today, I don't know if you saw that or not, but the Indiana State Department of Health is gonna supply free testing if we agree to be a test site. Now, it's a $50,000 deal, and we would have to provide a special, I don't want COVID patients coming into the health department, we're gonna have to work on that. But the current Optum site lasts through July, and then we've gotta get something going after that. But we will have testing available, free testing. Now, you can always get it at Reed, but your insurance has to pay for it there.
So you're saying that Optum is gonna be done at the end of July?
Maybe, I mean,
Oh.
they're for
Hopefully, if our
sure.
numbers stay up.
If our numbers stay up,
if
they'll
we-
keep
Of
coming.
people
but
being
they're
tested.
Definitely
People
until
being
the end of
tested,
July.
yes,
but-
we know for sure they're gonna be here until the end of July. After that, it's up in the air.
And the hours are 8 to 8.
7 to 7, they just changed it.
Oh, did they change
Yes,
it?
What's
Cool.
the cost of the COVID tests through Reed, do you know?
130 or
I am not sure.
90?
I don't know. that answer, I'm sorry. Megan would, but I don't.
That's fine.
I apologize. I don't know off the top of my head.
So what you're saying then is if the testing continues to stay steady, they will stay here in Fayette
Correct.
County.
That's right.
But if our testing drops off,
Through Optum, the state will take that, and then Dr. White just received an email, which I did not get, but
Yeah, we have to decide whether we want to be involved in that or not. Otherwise, you're gonna have to go to Reed or another county to
I
get a
guess that is
test.
an opportunity that we could have
Yeah.
a testing site at the health department, which we don't know about yet. So that's up in the air.
okay. So another question, and for everyone, that when we created, like I said, we could have had a 100-page document with all the procedures. So we really tried to narrow this down to cover the big points, but a good question, will staff be trained? Yes. That's gonna be a big part of that. I've talked with Kelly Gettinger, our head of health services, in coordination with the health department. We will provide training, and we're creating a lot of other documents for parents too to help educate them. So yes, there will be training for bus drivers, all of our staff, that's already in the works, so that will be a big part of this. So yes, that's a definite yes. Question on athletics, will athletes with health concerns
Or worried parents.
or worried parents be penalized for not attending during this period? We're not trying to make this punitive at all. It's just like our attendance policies. And if there is someone who's worried, just communicate with the athletic director and with that coach. You know, I think I said this last month, grace and understanding and patience is such a key part of this as we support each other. So our expectation is there is no punishment or penalty for not coming to practice. These are optional, and that's important for everyone to know. So parents need to use their very best judgment and work with the athletic department and the coaches.
But also conditioning is important for health
I
and
was gonna
safety of
say,
our
yeah.
athletes.
It is. And you know, if they don't feel they can be here, I would ask them to work with the coach, what do we need to be doing
Right.
during this time in July? So that would be the request I would have. I'm not the athletic director or the coaches, but I think the coaches would want, as a former coach, you know, that would be.
Well,
a good
and
point.
related to that, I don't know if you've thought about this, but if you have kids whose parents have opted for them not to attend because of fear, will they be allowed to participate in athletics? And if I mean, on one level, I think if you're too concerned about your child being in a classroom, then
Yeah.
would your child be appropriate to be in athletics then? So, but I didn't know what your position is on that.
We are seeking some guidance on that
Okay.
because that is something a lot of districts are saying no. And the rationale is if it's not safe for your children to
Exactly.
be around other athletes and in the
Yeah.
school, it shouldn't be safe to
Right.
be in. What's your thought, Dr.
Yeah,
White?
exactly that, I mean, and then you offer the online schooling for the option, they wanna do that.
But if a child is doing the online learning option, are we gonna let them play football?
I just.
That's
That's
the
what-
question, Leslie.
That's the question.
You know, because, you know, I had one parent who's homeschooling a child, is very interested in learning more about this online learning option. That wouldn't be a case where the child's being kept at home for health reasons, it's a personal choice. But if we offer a better program and option than the homeschooling option, that's where the question comes up, if it's not health related, if they're fully enrolled in our school as a full-time student. So that's where I'm seeking some guidance from our attorney on, just because there are some factors in there that may not be related to health.
I actually had a lady call the health department this afternoon before I left and asked that similar question, because she wanted to know if there was an online option for the school versus, it'll take me 2 months to get my kid enrolled in homeschool, but my kid's not gonna wear a mask.
And not homeschool.
And I said, well, we're gonna discuss that tonight, and, you know, told her to wait and see, but I think a lot of that's just, if they have this opportunity to do the, you know, e-learning or, you know, through the school, I think that's great. That'll keep people in the count, or in the school system.
And that's a question that we discussed as superintendents. I've talked with probably half a dozen so far, because we have some families who like that attending school 7 hours a day isn't as good of an option for some kids. And they're enrolled in one of the online academies through, you know, Indiana that's approved. And if this is a program that better meets their needs, that's the question that's being asked. would my child have a chance then to play in the band or do these other things? So that adds a different layer to it, in my opinion, if it's not health related. So I'm waiting to get some guidance from her, but your thoughts on that? Or do we just, is your recommendation a blanket no, if they
I think we
participate in
need-
online?
I think we need to get some guidance, because there have been issues with homeschooled athletes that have been allowed to play high school athletics because they have been partially homeschooled, and then they take a certain number of classes physically at the school. So that would be something that the IHSAA basically deals with.
Well, they're giving us more leeway too, but the guidance I've gotten from the DOE, there's been some communication about this is different than a homeschool. Like some districts will allow you to take 1 or 2 classes on site and you can participate in extracurricular as a
Right.
homeschool student. We don't allow that. Our policy in Fayette County Schools is you're a full-time student enrolled here. These kids would still be fully enrolled according to the state of Indiana in this, what we're offering. It's not gonna be a homeschool option, it's gonna be an online, you're gonna be a full-time student in Fayette County Schools. That's the question that makes this different, it's unique. So I would love to share with some of our homeschool parents what we're gonna be able to offer, because I think it's gonna be pretty exciting. And so, that may be a way where some parents may be interested in exploring. So I have a,
But if it's for the health concerns,
that's the bigger one. Health concerns, I think we need to
No,
address that
Yeah,
differently.
the health concern, why would you wanna send your kid out to the athletic fields?
Exactly.
I can't imagine that happening, but you never know.
You
We have
never
to
know.
be prepared.
You don't know.
So-
I would be against that. If you
Exactly.
got a health
I would
concern, you
too.
got a health concern.
So-
And that's from our side and their side.
Exactly. So that's been my thought, but like I said, my question is more of those who may want to try public school through this method first or something. I think that's where we're struggling as superintendents, to try to figure out how to handle a unique situation.
and financially, I noticed that the State Department of Ed was giving more funds.
They will allow 100% tuition reimbursement for kids fully enrolled in a program like this, which they haven't allowed.
Yeah,
So I want to make a program that supports our kids no matter what. If they have health needs or they're quarantined, we have to support our kids and do as good a job as we can. So that's a unique situation. Are there more, Kim?
Yes, three more.
I put my glasses on. Okay. Oh, she's using half paper now. She must be running out.
get to all those that are in front of you, because you had those too. I didn't know if you looked at all those.
Yeah, does the school district have plan to obtain tests? Yeah, the online option, we talked about that. Will staff be trained? Will athletes with health concerns? Those are the links not working. Okay, will lunchtimes be extended so they have time to wash hands and still have time to eat? Yes. That's gonna be part of the flexibility, is we have to adjust some schedules.
Scott, I think that's important that you stress that word, flexibility.
Yeah.
We're all in the unknown to a great
Right.
extent. So we're gonna be flexible, it's just good sense for us to be.
When I opened it up and said, tell me what we're missing, and the what ifs started from our administrators and teachers, and I was wide awake every night thinking what ifs. And so we are gonna have what ifs that we're gonna have to face, but we're gonna always keep in mind what's best for our kids' health and our students' health and safety. And we're gonna rely on the health department a lot. Will additional custodians be hired? Yes, we're working on what staffing we're gonna need, because just sanitizing and cleaning surfaces and doing those things is gonna take additional time.
How are we gonna do about subs? Are we gonna is that a concern for you
Yes.
right now?
it's a huge concern.
Yes, many of our subs are retired teachers. And, many of our bus drivers are in a higher risk age category. And, so those are concerns that, are we gonna have enough subs? Kim and I may be subbing,
Well, I had an
honestly.
interesting conversation today with a gentleman who's a recruiter for National Guard.
Oh.
And they're getting too many positive tests when they're sending people to boot camp and assignments. And so they're talking about possibly encouraging their people to substitute. So I don't know if that's even an option for you to contact the local recruiters about.
Talk to
We would
Tina.
love to have them.
Yes.
I know,
Yeah,
Can't pass
but I thought that
There's
was
a
so
second
interesting.
question on that one for, just put up over there to your left.
Good question, because this will be in our plan.
It's been asked several times.
It's been asked several times, can students start in remote learning, then go back to the traditional school model later? What we're working on now is we will set it up probably by quarters. We do not want kids coming and going in the middle of a
Right.
grading period.
Yeah,
So,
Chaos, yeah.
you know, and I've been talking with others at the state level too. We probably will do quarterly enrollments or semester. So yes, we have thought of that, and we are gonna communicate that clearly in our plan. So we may do 9-week, just because that's a natural break.
Right.
The challenge is, you know, making sure kids can jump into a high school class at the semester to make sure that they can be supported as needed. So, yeah,
But
that
that
is
doesn't
definitely.
apply to kids who, let's say a parent tests positive and they're out for a little while.
No, that, they'll stay enrolled in the regular
Okay.
school, and then
Okay.
they'll just receive the support.
Okay, so they won't go to FCSC online?
They will be, that will be their option to get the
To stay.
lessons and resources during that 2-week period.
Okay, okay.
Yes, but they won't be automatically just placed there permanently.
And will parents be allowed to do the packets as opposed to online? And what are we talking about with connectivity issues for kids that live in areas?
Well, I do hear that Hillfi
Yeah, they're
is
doing
installing a
great.
tower at Everton.
Yeah, they just put it up.
And, you know, we are working on a grant. I don't know if any of you saw that. It's a $61 million grant the state, the governor announced. It's competitive, but we are looking at ways we can provide MiFi hotspots and different things to kids who need it. We've got a creative idea I talked with Dan Parker yesterday about, where we may be able to do some things to provide service in our northern and southern parts of the county too. So, nice thing is with the Hillfi is their local men who own that, you know, the gentleman who owns it is very invested in our community. So, you know, we're exploring some options. That grant's due the 17th, so we are definitely looking at ways. We did have some MiFis, if you're familiar with those hotspots. We had a limited number we were able to get last spring, and we did make those available to some families. Problem is, you get out into, you know, down around Garrison Creek and areas. I have Verizon, and I think they have the best coverage in the county overall, and I had no service, and Kim's on Sprint.
And I don't have service anywhere.
She didn't have service anywhere in that area, so it's, a lot of it is if the MiFi has enough service to pull in the cell phone signal too. But we are working on some ideas to help support.
And so would that also mean, like out in the county, say in Orange, would one of the churches there be, I mean, I know with some of our school buildings, didn't we open that people could park in the parking lot and do that? I mean, not that that's desirable by any means to have to sit there, but is that what you're talking about by locations maybe in the county that are?
It's a lot bigger than that, but I'm not ready to put
okay.
it out there.
All right, good.
It would be,
Those cell towers.
well, I'm not, we're gonna apply for this competitive grant.
Okay.
And I believe because of our demographics and our connectivity, we should be able to be successful if it's written well. And
Okay.
What about the children for whom electronic learning simply does not work for them? That even, one of the things this woman brought up today is that even under the best of circumstances, e-learning, even if you had the connectivity and you had the support, e-learning, distance learning is simply not the optimum way for children to learn. So I think we need to, if at all possible, keep a pencil paper option available, because e-learning works well for some, but it doesn't work well for everyone. And I think I'm prejudiced as a classroom teacher, where you had to adapt what you did in a particular classroom to meet the educational needs of your children. You changed your lesson plans, you changed how you presented things. And with the e-learning type things, it's basically a one-size-fits-all.
But you're
And
specifically speaking to the 14-day quarantine child who's home for just the short time that needs the packet at home?
Or if this is fluid and changing and we get another stay-at-home order in November and schools are shut for a month.
yeah,
Okay, because they can choose to do the e-learning or come to the classroom. But if they have to stay at home in quarantine, then yes, there should maybe be a packet option available for those
Well,
children who can't
some
e-learn
kids
as
just,
well.
just do better that way.
Which I agree, but they wouldn't choose the e-learning path if they don't learn well on the e-learning
We've had
pathway.
multiple parents who originally put their kids on the e-learning when we closed down in March. And because they thought this is really good, and it didn't work well for them, and then they were able to opt out and change to the packets within a certain amount of time, and felt as if that would just work better. But I think that I'm certainly in agreement that we need to improve our connectivity and give the opportunities for all of our children to connect in this way, but fully realizing that this is not the optimum way to teach a lot of our students.
And I think the survey that the parents did shows that that's true.
Yeah.
They want us in school, they want their
Yeah.
kids in school.
Right.
So I think the great majority, and I appreciate the parents and the amount of feedback we got, but I think they're telling us they want school to start, they want their kids in school, they don't want them doing e-learning.
And I don't want to get too far out because I don't want it to be this is the plan, because we aren't ready, but we are looking at some creative ways where we can provide a site for parents to come in socially distanced, where their kid may need some tutoring, where their kids may need to come in and take an assessment, where we use Google Meet, which is like Zoom, to bring kids into the classroom to watch the instructional lessons and then record those, where kids will have access through a password and code where they can go on and view the lesson for their core content classes. So they can see the lesson being taught in person. They can be a part of that class through that way if they can't be in school. But we're also gonna have,
But you don't have to reveal that. I think what I'm hearing everybody
we
saying
will have
is
paper options
if
for
there's
people
a-
too, yes.
Right, and the other one was, I had parents tell me if they had 3 kids, and they did have devices, but they had satellite internet, it slows it down to nothing, yeah. So, and I suppose a Mi-Fi would help for a couple of, but it just, that's not connectivity, but it is.
It
It's-
is.
I think the important thing to note is we have heard the complaints and the concerns, and while I still say our teachers did a bang-up job, I mean, under the circumstances. But even I think as a teacher, they would recognize there were some shortcomings in the way that we did it, and we don't want to continue that way. And I have an e-learning committee of teachers and administrators, and they have listened to the feedback that they have received over the spring e-learning process. And it is not going to be anything like it was in the spring. It is going to be so much better, but we just want to make sure that we have all of the things in place before we put something out there and then we can't follow through with that. But we have listened, and it is a very unique, out-of-the-box type of thinking, and I think it will appeal to a lot of people.
Well, we did the best that we could do.
Sure, and teachers, they did awesome.
Yeah.
And students and parents did awesome. I mean, parents were teachers
Yeah.
for the first time, and, you know, they had to learn algebra and economics and things, and work full-time jobs, and so, I'm not thinking at any point we're faulting anyone for anything. I think we all did what we could do to survive something that we've never had to experience before. And I think going into the fall, we're still going to have that learning curve, but we've taken what we've learned from that spring season and we've tweaked it to make it so much more valuable for a student that can't be in the seat in the classroom. And it's exciting.
And we're being evasive, it's not because, I don't want anyone to think we're trying to keep anything from you, but it's also, we want to be sure that our plan is solid and we can pull it off. And so there's lots of layers, but I think it'll be something, when I talk to other districts, I don't think anyone around us is going to be doing anything like this, where we can connect kids to classroom teachers and to their peers even, and finding ways to use some of our facilities to have some areas where parents can schedule times for support there too. So I look forward to rolling this out in the next couple of weeks. I hope you guys are excited as kind of as we are once we're done. So, but yeah, duly noted. I heard that from a lot. The packets worked better for some. Others, that was one of the big pieces. We have the remote learning survey that I haven't had time to get through everything yet because we had about 800 responses to that. But the packets, being able to print them, communication, availability, those are all the pieces we're working on. So what we offer again won't be what we did. We were really, our teachers, and we were not set up, no school district was set up for that.
No.
E-learning was set up for 1 or 2 days when you had snow days in districts that had it. So we all learned from this and we've been collaborating together as districts. How do we get better? But I think our idea is going to be pretty unique. So more will be coming soon, I promise.
One more question that has come in since then, it just says, will there be more information on the online option? Is this just for high-risk students or those who are quarantined?
It's going to be there for parents who have concerns about sending their kids back at this time, as we stated, and we will be providing all the details for it in the next couple of weeks. It's still a work in progress. So we want to give parents a couple of weeks before school starts to make sure they can make an informed decision, ask questions. So that is forthcoming. So yeah, it will, we're going to offer 2 options for school. On-site, more traditional with enhanced procedures and cleaning methods and sanitation, and then an online option, because we could very well be placed back into a situation where our schools are shut down, and we have to be prepared to handle that as well. Knowing there are still going to be some connectivity issues, so we're looking at how can we create more hotspots around our school facilities for parents to pull up in their cars. Right now we have minimal connectivity outside. Our high school courtyard has connectivity out in it. It's all enclosed now. So, that's something Terry Miller's working on in this grant. How do we get more hotspots outside of our facilities and all of our grounds? That's a way parents can use that. Are there businesses that may allow some access? So that's another piece we're looking at. So, there's still a lot to do, but we know that we're going to make it a lot better, and we have time to do that, which is huge. So any other questions that have come through, Cindy?
No.
Any questions from the board? Because my next is a request to the board to approve the plan as submitted and reopen school with the understanding that on August 5th, we'll start back with regular operations, but we will also have an online option. That doesn't necessarily need board approval, but we will share those plans out with you all and vet them through you, and then also, get them out to our parents and staff. So that is my recommendation for the board's consideration, is to go ahead and approve our plans, knowing that it's a living document and it will be tweaked as we require. It's fluid. That's the word we've been using. Everything's fluid, but this is what we're working under now. And as you heard, we already have a couple of changes that we're going to make to it. And we will keep that information updated on our website for the community and staff to view it. So that's, Mr. President.
Well, there we go. So I'm going to seek a motion to approve the COVID-19 school reopening plan.
I so move.
Yeah, I'll second that.
Thank you, Chris. Any further discussion? I just want to say thank you for the hours of work for all of
that's
you
a ton of
who have contributed, the health department, our administrators, central office, all of
Yes.
you.
Yes.
Hopefully it
Amazing.
will allay the fears of the patrons of the Fayette County School Corporation and the citizens of Fayette County that we're going to provide a safe learning environment for our children when we open school again. And I think all the parents will be glad to have their children, most of the parents will be glad to have their kids back in school.
Most. But we also know there's some parents who like that online option. In our
Yeah.
survey that I've had a chance to read, so we're going to have 2 options, and that will be clearly laid out and spelled out. And then I just want to reiterate, we're going to work closely with Dr. White and his staff throughout this. And our FCSC Connect email is going to remain live. If people have questions next week, we will respond to those, and then we will add those to our FAQ too. If they're not repeat questions, we'll make sure we address those topics there so people can go on and check new information as well. Try to be as fluid is the word, as transparent as possible in this, because we're all in uncharted territory. And you look at what Andy's doing in your practice with the precautions, we all are, and everything we do, and we're learning as we go, and we know a lot more than we did 3 months ago.
I have one other question, I'm sorry, I
No.
just thought about it, Career Center. We didn't talk about that, but I'm assuming that board it's separate, and so they're
Yes.
making their own recommendations, is that right?
Yes,
for the
as the LEA, we're the local education agency for the Career Center, they will operate under these same guidelines.
Okay,
However, each school district, I want to commend the area districts, as we've been in communication, especially Franklin County, Union County, Rush, we talk weekly. And we communicate, Centerville and Western Wayne, Steve Dungan really brings them in to talk to. So I think all of our plans are gonna be pretty consistent with what we're doing, so it shouldn't be a big change for kids from other districts coming in and following our guidelines.
Okay.
They're all pretty well following what's been recommended by their health departments and CDC, so.
Same way with the calendar, those schools have all committed to,
There may be a little bit of change here and there, but they haven't made any wholesale changes. I mean, like Union County's calendars, they start a week later.
but they
I think,
are
than us.
anyway, yeah.
But none of the area districts, to my knowledge, are making
Good.
any changes with start dates or anything like that, so.
We appreciate them following our
Yeah,
lead, and we welcome
right.
them to come down here, and we hope more of them come.
yeah,
We may have a record enrollment this year there.
That'd
if
be
things
awesome.
hold.
That's
wow.
The Law Enforcement Academy
Oh,
is
yeah.
Oh, yeah.
full. with
Talked to
interest.
Jason, he's excited, he
Yeah.
can't wait, he's
Yeah,
working
it's
on
gonna be
curriculum right now.
That's great.
So,
Well, thank you for that. I just want to clarify because we didn't talk about them directly.
and thank you both for coming in.
Yeah. Well, we have to
That's
vote.
important.
Yes, and
We haven't
they
voted.
have
Yeah, okay.
Okay,
Yeah.
do we have the motions? We did, no further discussion?
We
All-
just had discussion.
Yes, all those in favor signify by raising your hand,
Aye.
opposed, same sign. Motion is carried. So we have one more item, Chris.
Chris?
Well, I have one thing.
Oh.
I'm sorry, I don't have a
Uh-oh.
place to talk. I don't know if you saw the paper, but this little gal is a hero, Elena Markham.
Yes.
Oh,
There's a
yeah.
really great story in today's News Examiner about Elena and just the fighter that she is. She was a junior at CHS this year, and she was a young lady that was burned over 85% of her body, third-degree burns, back in February. And she's a remarkable, she came home yesterday.
Wow.
And
130 days.
130 days. And I just want to publicly acknowledge the courage
Yeah.
and the support that her family and the community's provided. But, this little gal is just a
Fighter.
fighter, and just, I just wish her well, and I hope her recovery continues, because she's one of us, and she's one of our kids, and anything we can do to support her is just awesome. So I'm excited. I just read that article
Yeah.
this evening, so
I'll look
that's
forward
what I
to
wanted to
reading.
share.
That was
I saw.
Do I hear a second? Thank you, Dennis. All those in favor signify by raising your hand, opposed, same sign. Meeting adjourned.